in Omaha, the Nebraska Medical Center released a public statement about the fact that their numbers are the worst they have been and getting worse because they want the public to know and they want the public to do something about it. Quote, as we have reached an all-time high in COVID-19 positive patients receiving care at Nebraska Medical Center, we encourage people to continue to do the things we have been encouraging people to do from the beginning. Wear a mask in public, practice social distancing, avoid large groups, wash your hands frequently, don't touch your face. And this is important. Those things may be even more important now than they were when this began. So says the Nebraska Medical Center, which now has more COVID patients than they have had from the very beginning, with numbers continuing to rise. Social distancing now more important than it was when this all began. It's counterintuitive, or at least it's counter-narrative in terms of what you're hearing, in terms of the national discussion about what's going on with the epidemic and the way things are opening back up and people looking toward the fall and all of this stuff. It doesn't match with that narrative that social distancing would be now more important than it was when all this began. But if you think about it, not in terms of sort of the chosen political narratives and what everybody wants to be true, but rather what we know about the virus, it makes sense. Because in America, where we've got over 1.6 million cases, and we're closing in on 100,000 deaths, where we've got the largest epidemic on Earth, over time, over the past weeks and over the past 2 or 3 months, our epidemic has become older, more mature, and significantly larger. We've never been above 1.6 million cases until now. We're above 1.6 million cases. It's getting bigger and bigger all the time. More Americans are getting infected all the time. And, you know, in places like Omaha, Nebraska, the beds in hospitals are much more filled now than they were before. So, yeah, as we get further into this thing, without having come up with a way to responsibly control it in most of the country, now is the time. That the social distancing stuff, the things we did to try to keep this thing in check, are way more important even now than they were before, when the epidemic was smaller, when there weren't as many people in any given community that might have it. It makes sense in virological terms, right? But of course, we are approaching this as a country in exactly the opposite way, right? We are seeing case numbers go up. We are seeing hospitals in far-flung areas of the country fill up. And this is now the way we're spending holiday weekends. I mean, in the great state of Arkansas, the governor there, Republican Governor Asa Hutchinson, this weekend appeared completely bewildered in public by the fact that his state is going through what he's calling a second peak. Yes, Arkansas numbers are spiking. That's going to happen when you don't have any policies in place to mitigate the spread of a widely distributed, highly contagious virus. The virus will then spread, and your numbers are going to surge right back up as you encourage people to get out and be around each other more. I mean, it's just called math. It's amazing, and it's apparently absolutely bewildering to Arkansas's governor, Asa Hutchinson, who thought this was all behind him. But Arkansas is peaking again at a higher rate than it peaked the first time. Arkansas is one of at least a dozen states where case numbers are not just unmitigated, they're still just shooting upwards. Other states with Arkansas in that leaky boat include, yes, Alabama, I am sorry, Montgomery, where your hospitals are already overtopped. Also Florida, also Georgia, also South Carolina, Tennessee, North Dakota, Oklahoma, cases rising in all of those places. We also just saw Virginia hit its record high for new cases in a single day. And North Carolina, too. North Carolina hit its record for new cases in a single day on Saturday. They then hit their record for COVID hospitalizations yesterday. Right, because as the doctor in Alabama said, these things do tend to go together. You get more positive cases, you get more people with the virus, you get more spread, you're going to get more people in the hospital. You get more people in the hospital, you're going to get more people in the ICU, you're going to get more people dying. These things are not unrelated.